This is Dr. James, and talking about your baby that's less than 2 months. It's very normal and extremely common for them to have wet burps. They're going to burp a lot and have little spit ups, but it's not normal for them to have excessive vomiting. If they're vomiting forcefully, they need to be seen because it can indicate so much worse things than like your normal person. Normally we think, oh, we're vomiting, we got some bad food, or we got a little GI bug. But in a baby this young, we're going to be thinking about meningitis, kidney infections, and intestinal obstruction. So if your baby is forcefully vomiting in that first 2 months, you need to make sure and see your doctor.